Hello, I'm Dr. Eve. As women get older and begin to go through menopause, there is a deprivation of estrogen. They lose their estrogen, and that results in menopause beginning, and many different kinds of symptoms begin to happen. Hot flashes, some kind of mood change, and lots of changes to the vagina. Here is a letter from a woman who talks about her experience of beginning to go through the pause. She says she is married to a great guy, and they've been together for 14 years. They've been married for 3 years. During the last 3 to 4 years, my sexual drive has gone down from what it used to be. I've gone through menopause. I tried hormone replacement, but within 3 months, I got a deep vein thrombosis. This was a pity because I was beginning to feel really great again. I've been advised not to go back onto it. I'm also a type 1 diabetic. It's not really a major stumbling health block for me now. Is there anything that I can take to get my groove back? This has a number of really interesting sexual medicine components to it. One of the side effects of hormone replacement therapy can be that a woman will suddenly have a deep vein thrombosis. And that means that she absolutely has to stop taking any kind of hormone therapy because it's contraindicated. If you are a woman who does already have deep vein thrombosis, you should not be taking hormone replacement, but talk to your doctor about other alternatives for managing your symptoms. Being type 1 diabetic means that as you get older and going through menopause, it is going to impact onto your vagina. And the way that it impacts is that it makes your vagina somewhat atrophied, which means your vagina gets dried out. The estrogen inside of the vagina gets lost and no more is being produced because you don't produce estrogen. So you have to begin to replenish your vagina. What I would recommend is that you talk to your gynecologist about the possibility of getting onto a local vaginal estrogen replacement, which means there is something that just goes into the vagina, which won't affect the rest of your system and may do very well with that despite your diabetes and your deep vein thrombosis. Together with your estrogen, you should be using other kinds of moisturizers and silicone lubricant to help with penetration and making sure you don't get any kind of pain with penetration. So one of the products that I recommend is KY Liquid Beads. This is an ovule of silicone that gets inserted into the vagina and will melt in the vagina, giving you wonderful moisture inside the vagina, which will last for hours during lovemaking and for some time afterwards. So this will be very useful to you at this time of your life. In terms of getting your groove back and wanting to feel sexual, that's way harder. There aren't any medications that are prescribed for this right now. So we have to be quite creative around over-the-counter medications or over-the-counter products. Zestra is a product that I have here in South Africa. And what that does is that it enhances and engorges the clitoral area in the vulva. And that will just increase your ability to become aroused and your lubrication, and that in turn will make you feel more desire. And of course, using a sex toy will be a great advantage to you. Putting a sex toy on your clitoral area will help you to feel sensation, and that might motivate you to be having sex at a later time. For more information, contact dreve.co.za.